By Healthline, I found this article, Why You Don't Need to Panic About the New Coronavirus. The coronavirus is still mainly limited to China. Now, I just read that I think U.S. has 14 cases, but I'm not sure about that. But I just read that this morning. The new coronavirus, first detected in China, has led to major public health responses in multiple countries. But if you're in the U.S., the odds of getting the virus are almost zero. Currently, the seasonal flu is a bigger risk to people living in the U.S. who haven't been to China. The new coronavirus continues to spread, with more than 24,000 cases in China and nearly 200 cases reported in other countries. The outbreak is serious, but if you're living in the United States, the odds that the everyday flu is a much more serious risk to your health. At this point, the seasonal flu carries much greater odds of killing you while in the United States than the novel coronavirus recently identified in Wuhan, China. Now, wait a minute. Is that supposed to make us happy or no? So we do have a seasonal flu that has a greater odds of killing us. All right, so far this season in the U.S., there's been a mortality rate from the flu-like illnesses and pneumonia of around 7%. Charles C. Bailey, MD, infectious disease specialist, St. Joseph Hospital, told Healthline. This should be compared to the 11 cases so far documented for 2019 coronavirus with no deaths. He said, I do think there's 14 cases now, but I didn't say death, but just cases of infection in the United States, Clearly, if there's no panic concerning the current flu season, which is a fairly normal one, panic over domestic 2019 coronavirus situation doesn't seem justified at present. Coronavirus deaths still less than 600. That I think I disagree with in China. I think I totally disagree with that. According to the Centers for Disease Control and Prevention, flu caused about 60,000 American fatalities between 2017 and 2018. To date, the number of deaths due to the new coronavirus in China are 564. Again, that's questionable in my mind, but according to the latest report from the New York Times. Additionally, 2 people outside of China have died from the disease, one in Hong Kong and one in the Philippines. This is not the first respiratory virus epidemic or pandemic we'll see, nor will it be the last, I'm sure, said infectious disease specialist Anita Sinkar, MD, Providence, Little Company of Mary Medical Center in California. It's too easy to believe everything that's posted on Facebook or Twitter and get swayed into hysteria. Educating yourself on what's happening is the strongest weapon against panic, she added. A new viral outbreak is scary, but it's important to remember that the United States has been preparing to combat such an outbreak. While reports find China mishandled the 2002 SARS epidemic and may have been delayed in recognizing the seriousness of this new outbreak, the United States is unlikely to have the same issues. If we take strong measures now, we may be able to blunt the impact of the virus on the U.S., said this doctor of the National Center for Immunization and Respiratory Diseases. Experts emphasize that this coronavirus is, at this point, less dangerous than the SARS epidemic, was also originated in China. SARS was not especially transmissible, but more deadly, and was eventually controlled by public health measures. And nCoV seems to be quite a bit more transmissible, but less deadly, said Gary Whitaker, PhD, professor of virology at Cornell University College of Veterinary Medicine. Veterinary medicine? I'm confused. Federal action taken to avert crisis. On January 31st, President Donald Trump issued a proclamation that during the 14-day period before entering into the United States, it is the interest of the U.S. to take action to restrict and suspend the entry into the U.S. as immigrants or non-immigrants of the aliens who are physically present with the People's Republic of China. While this is unlikely to stop the virus, it may slow the virus down enough that U.S. cases can be handled better. President Trump also determined that the U.S. should take all necessary and appropriate measures to facilitate orderly medical screening and to quarantine those allowed to enter the U.S. who may have been exposed to the new virus when appropriate. Current measures are quite appropriate, in my opinion. Quarantining symptomatic returning travelers who don't require hospitalization and isolation, asymptomatic travelers for the 14-day incubation period. I heard it was 24-day incubation period. I'm confused. But anyway, will prevent any significant domestic transmission, Dr. Bailey confirmed. Quarantine effectively restricts spread of disease. I'm just going to kind of skim through this. Isolation is a public health tool that's used when we restrict the movement of someone who's already sick with a specific illness. Quarantine is basically when we have a recommended movement restriction or some kind of conditions on that movement for people who are exposed and not yet sick. Okay. Dr. Sinclair said it's important to think in terms of person-to-person transmission and consider that there are just 11 confirmed cases in the U.S. Like I said, this story I believe is on the 6th, and just this morning I heard that we now have 14. The risk of infection is dependent on exposure. For the general American public, the immediate health risk from the 2019 NCOV is considered low at this time. Again, I did hear that if usually hitting people if you're sickly, and your immunity is really weak. The viral outbreak is still in its early stages, and there's potential for it to mutate or for deaths to be undercounted at this early stage. But at this point, the death rate for the new coronavirus appears to be around 2%, far less than SARS, which was 10%. And confirmed cases of infection, reported symptoms range from people with little or no signs to those with fever, cough, shortness of breath. Now, if you start to have a fever or cough, you might just have the cold that's going around or the influenza going around here, so don't panic. I just read where a man, and I think he was in China, he was having some heart symptoms, and he went to the doctor, and the doctor told him to wear a mask. Now, the doctor was telling him to wear a mask because his immunity was probably low because he was sick, and the guy took it that he had the coronavirus, and he didn't want his family to get sick, so he killed himself. Without even knowing for sure that he had the virus, he killed himself, which is so sad. He was 50 years old. He didn't want to spread it to his family, but he probably didn't even have it, but he was panicked. The virus can infect people of any age. Older people and those with asthma, diabetes, or heart disease appear to be most vulnerable to potentially life-threatening illness with this virus. Just as with any virus, actually, I would imagine. So the CDC reports that the immediate risk for America is low at this time, but they emphasize that everyone can do their part to help them respond to this health threat. This includes being vaccinated for the flu, and that's a matter of opinion, and taking normal preventive actions to stop the spread of germs like frequent hand washing. And have I ever been doing that? And guys, wash your hands for 25 seconds. Avoiding close contact with sick people and staying home when you're sick. Good luck with that. A lot of people don't stay home when they're sick. The doctor explained it's important to consider how much less deadly the virus is compared to previous coronavirus outbreaks. What is indicative of severity is the case fatality rate of the virus. SARS killed 10% of infected people. For every 50 people infected, 5 died. MERS killed 35% of those infected, so out of every 50 people, 17 died. The 2019 NCOV has so far killed about what they say now, 2.2%. For every 50 people infected, 1 has died. All right, guys. I'm just going to, say what I feel and what I've read, and you guys decide the rest. And just, stay healthy. Keep your immunity good. Try to eat healthier, get a little exercise, and get plenty of sleep. And lots of prayers. Have a great day.